Choosing the right kind of prostatitis treatment can mean the difference between years, even decades of pain, suffering, and agony from recurring inflamed prostate problems, and quickly knocking it out, or at least controlling it. First, let's start with what often doesn't work, and then we'll cover some things that you can do that are more likely to get the job done. Listen, many kinds of men suffer from prostatitis symptoms, and in some cases, it completely dominates their lives, including their sex lives, social lives, and professional lives. It interferes with sex, sometimes making it painful or impossible. It prevents them from having any fun, not being able to drink anything but water, and always having to be on the lookout for a bathroom everywhere they go. And it can cause missed work days from the pain and discomfort, as well as make it hard to focus or even sit down for more than 20 to 30 minutes at a time. It's a horrible condition to have, and unfortunately, prostatitis is not always easy to treat. Usually you will be prescribed something like antibiotics, and while they might help sometimes, they often do no good whatsoever. Plus, even if they do help, they probably won't do much good if you're needing chronic prostatitis treatment when it keeps coming back. In some cases, doctors will even tell you there's nothing they can do, especially if nothing shows up in your blood, urine, or semen test. So what do you do then? Fortunately, there are some alternative options for you to consider. In some cases, they're not all that different from the BPH treatment. For example, make sure you're getting enough zinc, either in your diet or via supplementation. Believe it or not, many times when a man has prostatitis or an enlarged prostate and gets the zinc test, he will find he's low in zinc. Just make sure you don't overdose on zinc. Too much, like with anything, can be toxic. Also, try to relax. I know that's easier said than done. But the reality is, anxiety can make prostatitis symptoms way worse. Many times, doctors will even prescribe something to help you relax for this very reason. And the anxiety caused by the pain and the uncertainty of why it won't go away can and likely will make your symptoms far worse. Finally, seeking the right kind of medical advice. Yes, consult with your usual doctor. And yes, you may even want to see a urologist too. But realize, most doctors and urologists are not experts in infections. They are either general doctors or surgeons, as in the case of many urologists. That does not mean their advice is worthless, but if you have a foot problem, you don't see an eye doctor, do you? Of course not. You would see a foot doctor who specializes in feet, right? Well, guess what? It's the same with prostate infection. Make sure you also seek help from doctors and specialists who are experts at infections, and not just from those who are surgeons or GPs. There are other things you can do, of course, but the above are great starts, simple as they may seem. For more prostatitis treatment ideas that are safe, cheap, and can also enhance your sex drive at the same time, download your free report. The prostate healing food that is so sexually potent, priests were forbidden to eat it at www.prostateproblemsfixed.com.